I am Steve Stroud, and I am a cancer patient here at Emory Hospital in Atlanta, Georgia. The tube was added before I started radiation on my throat. The doctors and nurses knew from experience that the swallowing was going to become very difficult as my throat was radiated to kill any remaining cancer cells. That was done, and even though I could still eat for several weeks, the tube was there, but lo and behold, they were correct. There came a point where swallowing was very difficult, and it was time for me to start using the tube. I was skeptical. I couldn't imagine, having never had radiation, this type of radiation, or never having been ill, period. I couldn't imagine what was going to happen exactly, even though the staff, the nurses and doctors were very thorough in their description of what was going to happen, but just hard for me to comprehend in my mind. It wasn't a problem. It wasn't a big problem. I just, okay, I'm going to have a tube, and they put me in the hospital. I stayed overnight just so that they could monitor it and make sure that everything stayed in place, and there was no pain with it. It was just a kind of in and out thing. And the only reason for staying overnight was to make sure that everything seated well and that the tube didn't come out. When I was told they would be installing a G-tube for future feeding that I would need, I had no idea what it was. The nurses here were very good about giving me some literature to read. It had diagrams, and it was self-explanatory, pretty much. It was just tells you what it does and how it works, and it's pretty simple. It's just a way to bypass the throat to get water and nutrients into your stomach, and they go straight into your stomach. And so they were real good about that kind of stuff and giving me the literature I needed. Care for the skin around it it's not very difficult. Each morning when I take a shower. When I get out of the shower, I dry the area, and you'll see the tube in a few moments. Dry it off, pat it, dry it off, and in the early days I would put an ointment, antibiotic type of ointment on it, and then bandage over it. It seems to want to seep a little bit. It's just a very little seepage, because the tube is flexible to some degree. It'll move in and out of your stomach a little bit, and so there's some seepage. And it's what the purpose of the little the gauze that I use in tape is to just to catch that and not get it on my shirt or anything like that. Let's talk about feeding myself. There's an art to it. I found this out the hard way. You're given all the supplies that you possibly want or need, and you'll see in a few moments a syringe. It's just a gigantic syringe, and there are a lot of products on the market. Ensure is one, Boast is one, I think. They are designed for nutrient supplements, all the vitamins and all the stuff that you're going to need in there. And you draw it into the syringe, and on your tube, it's a rubber tube, and it has 2 outlets. And each outlet has a little cap on top. You just hold your tube, open the cap, take your syringe, press down like you would a syringe, give you a shot or something, and the fluid will go into the tube and then just seal it back up. Now, what I found that was very helpful for me is to get 3 or 4 of the syringes, so that when I would start a process of feeding myself, maybe it was water or say my dinner or whatever, I would fill up 3 of them at one time. I would open them up and I would just feed it in lock it back down, the tube, and then refill my syringes. So that it made it a little bit faster to do it that way. Keep a pattern going. Cleaning it is pretty easily. After I get through feeding myself, I just flush it with clean water, and that's all it's necessary to do to keep the tube clean. I feed myself anything that I want that can be liquefied in a blender. I've never been told that there was any limits to what I could feed myself. And like I think there's a lot of things that have some nutritional value as well and help you with the calories, help you keep that weight on, because you're going to be surprised. Weight loss is pretty common, I understand, with this chemotherapy and radiation. There's just a lot of reasons, and I can't explain them all to you, but you're not sitting down at a meal every day, you're not having dinners out all the time, you're not eating your normal routine. So I try to do things that keeps that weight loss to a minimum. I can't taste the food because it bypasses my tongue, so I never get to taste it. And shortly after the radiation started, before I had to start using the tube, I noticed that which I was told, my taste buds had been temporarily just knocked out. There are a few things that I can still taste, like chicken noodle soup, and I still eat that because I can drink the broth, and the noodles are soft, and I can get them to slide down. And I like that. It gives me a feeling of eating normally, and it gives me a feeling of being fuller. I mean, when I put this stuff in the tube, my food in the tube, my stomach gets full. But going through my mouth, it has maybe a psychological thing. What else could I put? Oh, each morning I try to eat a bowl of oatmeal orally to help my throat stay swallowing, stay active, and keep it moving. And I can taste a little bit of that. But other than that, no, tasting was no good.
Do you ever have reflux?
Yes, but they give me they've given me nausea pills and the nausea pills were just a byproduct of the radiation and chemotherapy, and they help keep down any nausea. So to answer your question, I've had no nausea that has affected or as a consequence of my tube. And the medication I have for it keeps it down, so I don't have a problem with it at all. Cleanliness is very, very important. Now, I'm a normal guy, and I wash my hands and do the normal stuff. But because due to the treatments that we are in as a cancer patient, be it radiology or be it chemotherapy or both, our system, our white blood cells, the count is down, which makes us more susceptible to infection stuff. So we're now more conscious about infection. Keeping that tube clean, I think, is very, very important. It's just, I flush it each time that I do it with clean water. I keep the ends of it wiped off where I may have some of my product go down the side of it or whatever. It's just to keep it flushed. And that's all I have had to do to it so far. Sometimes, if I'm full and I haven't got the top, in the process of putting the top back on, I'll see some of my stomach juices, for lack of a better word, that will come back up out of it. That's not a real pretty sight, but it's just the normal juices of what's going on in your stomach, and it's not a big deal. And I guess that kind of stuff needs to be cleaned also and help keep that area clean. The only problem I've had with the feeding tube so far is the feeding tube is attached with stitches to your skin when you leave the hospital. Now, I don't know if my stitches broke loose or whatever that were holding, as you'll see, the tab flat against my stomach. But at one point in time, I was trying to keep the nipple part of the tube pressed against my stomach. And the tube, without showing it's hard, but the nipple portion of it would kind of dig into my stomach, and it was rubbing, and it was making a blister or a sore area that really was becoming irritated and wouldn't heal. That's when I modified. That's when I modified the way I bandage it now, so that I have a little cushion there of gauze that serves to catch any overflow out of the hole that's there where the tubes go through my stomach, into my stomach, and it serves as a pad to soften any rubbing or anything that the tube has. But the tube just hangs in my shirt, and I used to worry about taping it up to my chest or whatever, and then making sure my chest was shaved because hair was growing, and it all got to be too much trouble. So it's inside my shirt. It hangs there, and it's not a problem at all. You know, this feeding tube is a godsend, because think about this. Without this means of feeding ourselves, people who are having treatments to their throat area, to the neck area, without the tube, they would be forced to swallow. And with the radiation on your throat, it's like a really, really, really bad sore throat. Really bad sore throat. And you couldn't get anything down. And then you surely would, your weight would drop. The balance between healthy nutrition and malnutrition would be right there and looking at you in the face. This tube allows a way to get the nutrition in and the water in, because swallowing is not a problem. There has been, swallowing is a problem now. The swallowing will get better. There has been rumored that that some doctors want to replace the tube at some point with another form of feeding, which goes down through the nose into the stomach. And that is very, 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 very uncomfortable. And the idea behind that is that would force, because it is so uncomfortable, it would force a patient to exercise their throat more and keep that working good, so they could get this thing out of their nose and stop feeding that way. But I think that the feeding tube is the most humane way to do it. And the patient is going to want to keep their throat moving, because you're going to swallow, even though you lose most of your saliva producing glands, you're going to want to swallow anyway. Because you're going to have a secondary saliva gland that's going to be producing, and you're going to be wanting to swallow. So I think we just need to keep the tube there, keep swallowing. Like oatmeal's great now. Oatmeal's wonderful, you know. And if you don't, I lost my taste for ice cream, because that was really a good idea, because it soothed my throat in the early days. But once there was no taste to ice cream, when orange sherbet tasted the same as vanilla, and the vanilla tasted the same as chocolate and strawberry, it was no point in eating ice cream anymore. So, but yeah, the tube has been very, very helpful. I think the tube is a godsend. I can't see any negative features about the tube. It's just like, my sister reminds me that I should think of the tube as my baby, as a small child, and I have to take care of this baby. I have to feed the baby. I have to water the baby. I have to change the baby's diaper, is bandaging, and whether I'm hungry or not, the baby has to have nutrition at every so long, every certain intervals has to have it. And so when I made a game out of it like that, then it's okay, I got to take care of the baby here. So we even thought about putting a little face on it if we could, and some little hair or something to give it a name. No, I haven't had any negative aspects out of this tube. When the doctors and nurses told me, said, "Okay, Steve, you need to do this, and you need to do this, because you got to have your nutrition, you got to have your water, we don't want you to dehydrate, we don't want you to lose a lot of weight." Okay, I understand that. But what I didn't understand is through this process of the treatment to fight this cancer, that the balance of my system between hydration and dehydration, nutrition and malnutrition, that balance was going to become so sensitive that just a half a day's worth of being out of the schedule would send me into a spiral that I could not on my own recuperate from. I couldn't drink enough water to do that from. We're talking about, if you've never been dehydrated, I went through hallucinations, pain. There was nothing that I could do to make it stop. There was nothing on my own. I could do nothing to make it stop, because once it started, it was just down, and so I had to come back in and try to fix it. And so what I have learned is take good care of the baby and treat it that way, and don't put myself in that position, because that was very frightening. So when the doctors say you have to follow the schedule, you have to do this feeding and watering, you have to have this stuff in your body, they're not just playing with you. They're not playing at all. And take it from one who has been there. It's not a fun place to be. It's not a fun place at all. So I advise anyone who's seeing this film, take to heart what your doctors and nurses are saying about the hydration and the nutrition, because you're going to need it.